The following is a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed are those of the advertiser and do not necessarily represent the views and policies of 630 CHED. You may talk to the experts by calling 780-496-0063 on 630 CHED.
Good morning. Welcome back to 630 CHED. Talk to the experts. Happy to have you with us on this sort of frosty November morning. Our next guests, I'm happy to bring them on board. Brand new guests. They've never been with our show before, but you might have seen them on our sister station, Global TV. Dr. Elena Hernandez Kucey and Dr. Brian Kucey are here from Kucey Dental Group and South Edmonton Prosthodontics. And Dr. Elena, Dr. Brian, welcome to the show. Now, do we have their mics turned up, Chris? We're working, because of course, still with a certain COVID protocol, we have them in one room and me in another room, and there's always at least that initial glitch, and now let's try to get, ladies and gentlemen, welcome to the show.
Thank you. Thank you for having us.
There you are. That sounds so much better. Now, because you are first-time guests, I always like to introduce our audience to you. Mm-hmm. So, and you have kind of an interesting story to tell. There's a lot of family history with your dental history. Can you share a little bit about how your organization came to be and a little bit about the family?
Well, our leader of our dental family was my father, Stanley Kucey, who was a 1955 graduate of the University of Alberta, and he promptly set up a dental office in his brother's theater, now known as Studio 82 on White Avenue, and then moved to the brand new outskirts of the city, which was Bonnie Doon Shopping Center.
Way out in the wilderness.
Yeah. So that was the start. Elena's mother was also a dentist, and she was trained in Havana, Cuba.
Also 1955 graduate, if you can figure. That was coincidence.
As it turned out, they were very similar characters, even though they were in much different countries, but graduated, at the same time. Elena's mother then emigrated to the U.S. in first New Jersey and New York area, and then settled in Miami. And Elena and I met in graduate school at the University of Southern California in Los Angeles. And then I moved back to Edmonton, and Elena agreed to follow. And it was a distinct time to do that was in the summertime. So she had no idea about this snow stuff, although she did see it in New York. Mm-hmm.
Good move, Brian.
A little milder, yeah.
And as it turns out, she is the diehard Oilers fan, which people just are amazed coming from Cuba. But that's where we are.
We have not only Stan and my mother as predecessors, but I had 3 uncles that were also dentists, so lots of dentists. And now we're so proud that our daughter, Kathy, has joined our practice. She graduated from the University of Alberta 2 years ago, and she is now 3rd generation on both sides, both grandparents.
So a 3rd generation dental office that has been basically helping people out since 1955.
That's right.
That's fantastic. So talk a little bit about the organization today. I'd like to know a little bit about your philosophy, and I'd also ask what was some of the best advice that your parents, if they were both dentists, passed on to you?
Well, we have the type of philosophy that our patients are friends. Many of them are people that we've seen for so many years. Even the new ones we meet, we just get to know them well enough that you can tell it's a big family of support. We're a good reference for people regarding their health, and we take that role very, very seriously. I'm a general dentist, as is our daughter Kathy, and Brian, of course, is a dental specialist. We'll meet patients who have more interesting things that they need help with, and collaboratively we all work together to make sure that, again, it's a long-standing relationship, and every step of the way takes them to a healthier place that we're very proud of.
We have a lot of things we want to discuss in the course of the show. Brian is a okay, I know I'm going to mess this up several times during the course of the show. Prosthodontist.
That's right.
And we're going to talk about what that means in our second segment. In our third segment, we're going to talk about some of the new things people can learn about what's new in dentistry, some things that you may not have heard of. So definitely make sure you stick with us. We've got really an interesting hour ahead of us. Brian, You are a prosthodontist. How long did you go to school to become a prosthodontist?
Well, the formal training for prosthodontics today is 36 months after dental school. Dental school is usually a 4-year program. So in the day when I went to dental school, it was 36 months over 4 years. So you can think of a prosthodontist as a double dentist. You know,
Yeah.
we have a double Tim Hortons. So the prosthodontist has this background, and there are also other things that are available to prosthodontists to become certified nationally and internationally as well. So we have less prosthodontists in Alberta than we have, for example, cardiac surgeons. So we are rare people. We've got way more hockey players than prosthodontists.
And it sounds like you went to school roughly 7-8 years to get that. And I know I went to radio school for 7 years just to learn how to say prosthodontics, and I'm not even doing that very well. Now, we talked about your folks both being dentists and the advice. Did they give you any advice? I mean, like, you obviously knew what you were getting into. You saw their lifestyle.
Well, my mother for sure would have taught me every person is important, regardless of where they come from. Many of her patients were Cuban immigrants or Spanish people, and they became some individuals that she cared for. And I remember she had a home office, and it was not uncommon to have the doorbell ring on a Sunday afternoon, and, "Doc, I got this little problem, can you help?" And you just learned that you needed to help people and make sure you took care of them and treated them with the utmost respect. And that's what I'd learned from her.
For my father, he was also a part-time teacher at the University of Alberta Faculty of Dentistry for 38 years. And he taught operative dentistry, which is that discipline of dentistry of fixing teeth with fillings and this type of thing, and little gold restorations. So he had his finger in that his entire career. He was also very active in church and the community and in the Edmonton and District Dental Society. And he basically showed me that we need to treat the patients as if the way we would want to be treated. And if that's a really simple rule. You just think, whatever this person's coming in for, how would we want to be treated? So we spend a lot of time at the beginning, the first time we meet a person, in trying to understand their concerns, their background personally, but also their medical and their dental backgrounds, and find out what their interest is in seeking treatment. So we have to have a really good understanding about that before we do any treatment of any type.
Yeah, I remember just thinking about my experiences growing up and having dentists. The best ones were dentists that you built a relationship with and that you trusted.
Absolutely.
Because it's a there's a lot of, I guess there's a certain fear factor for people going to the dentist. I mean, not to, I think you see it in all the cartoons and stuff. People are concerned about dentistry, but it has come along so much. I don't think that exists necessarily with kids nowadays. I think kids come in and it's a different experience for them.
Well, relationships are so important. So when you meet a new patient and you say, "Who was your last dentist?" and they absolutely cannot remember, it might have been 3 different people that they saw in their last several visits, and they don't have a relationship there. And I think that that's where we just take that time to make sure that we have the relationship that is ongoing and really catered individually to that patient's needs.
And Brian, is your daughter at home just now listening and hoping that Dad doesn't make any bad dad jokes? I know mine is.
I hope that she's out walking our dog right now and listening at the same time.
All right, we have much more to discuss. Thank you for being with us right now. We're talking to Dr. Elena Hernandez Kucey and Dr. Brian Kucey from Kucey Dental Group and South Edmonton Prosthodontics. They are located at 4628 Calgary Trail Northwest on the 2nd floor. Or office number 200. I'm assuming that's on the 2nd floor. You can find them online. I recommend you check them out at kuceydental.ca. Kucey is spelled Kucey, kuceydental.ca, or southedmontonprosthodontics.com. We'll be back with much more. Stick with us. This is Talk to the Experts on 630 CHED.
The proceeding was a paid commercial program. The opinions expressed are those of the advertiser and do not necessarily reflect the views and opinions of 630 CHED. You're listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed are those of the advertiser and do not necessarily represent the views and policies of 630 CHED. Now, back to Talk to the Experts on 630 CHED.
Welcome back to Talk to the Experts. We're joined today by Dr. Elena Hernandez Kucey and Dr. Brian Kucey from Kucey Dental Group and South Edmonton Prosthodontics. I sort of hesitate every time I say that. And Brian, I'm gonna explore this a little further now. You are a prosthodontist. Why would someone need a prosthodontist? And feel free to correct my pronunciation of it along the way too.
You're perfect.
Oh, excellent. Thank you.
You're perfect. This is all about the tist and the ticks. So the ticks is prosthodontics. That's the field of prosthodontics. And prosthodontist is the specialist of that field. So the prosthodontist is a specialist, one of the 9 recognized specialties since 1956. And we are the ones who are the diagnosis experts, the sequencing of treatment experts, and also the organizer. I often tell people we're sort of like the general contractor and also the architect. We have to have the vision for what the solution would be, the method of how to get there, and we organize all the procedures and the steps. So we often involve other dentists, other specialists, even other medical people in their treatment. So basically, prosthodontics is the replacement and maintenance of natural teeth with artificial substitutes. But there are other areas of prosthodontics. We can have fixed, which is things that don't move. We have removable prosthodontics, which largely people would recognize as dentures or removable partial dentures. We have also maxillofacial prosthodontics, which is replacing eyes, ears, and other facial structures.
So why would someone, what are the most common reasons people need you?
Well, the most common reason that I meet people, 2 different ways. One is that their dentist has recognized that the conditions that the patient has are beyond what they would like to get involved with, or the patient themselves could be a person that needs special management. So we're either having that type of problem or a technical problem, or usually a combination of both of those. The other way that people access prosthodontists often is when they are having problems and they have just lost basically confidence in what's being done. So we're kind of the doctor sometimes of last resort. When other things are not working, they often come and see us.
Now, do you need to be, you mentioned that people are often referred to you. Do people need to be referred, or can someone look in the mirror and look at a situation and go, okay, I need a prosthodontist for this?
Well, there's a lot of self-diagnosis out there, and of course the internet, the all-knowing internet, allows us to have a lot of information.
Yeah, watch out for Dr. Google.
Dr. Google never loses. So the situation is, if a person has a single tooth problem that they're concerned about and they want an expert opinion, that would be the prosthodontist. But there's only a certain number of prosthodontists, less than 25 in Alberta total. So most prosthodontics work is done by general dentists, and it has to, because there's so many people and only a few prosthodontists. So when a person could benefit from a prosthodontist, often they will first and should see their general dentist first and ask their general dentist. The general dentist can give them a lot of information and steer them in the right direction.
Okay, I guess that can be kind of an interesting conversation. I mean, some dentists can do it. A specialist is probably better, but it's up to the person, I guess, who's having the work done to make some decisions and ask good questions. Are there typical questions a person should ask?
Well, absolutely. Sometimes I see a person who comes in without referral because they wanted to replace a missing tooth, and the only thing that was presented to them was a method where they would have to have some work done on the adjacent teeth and make what we would call in the earlier times a fixed dental bridge. And the person really just wanted to replace that tooth. In fact, some of these patients are 60, 70, even 80-year-olds, and they want to replace this tooth, but they've never wanted to damage any more teeth. So they want to come in and talk about, for example, a dental implant, which can be done without damaging the adjacent teeth.
Mm-hmm.
Did you want to add something to that?
Yeah, I see the patients that come to the practice and end up with a prosthodontist, or patients that really have more questions than perhaps their general dentist was able to give them options for, and providing them with something that might be off the menu, if you will, in the general practitioner's hands would be what the patient needs to hear about before they make a choice. So I think it's a part of the process of making a decision to hear all of the options and not just necessarily go with what was old-fashioned and traditionally done. There are new, better ways to do things, even in a more streamlined way with less steps, that I believe the specialists are more capable of talking about.
You know, I think most people are familiar with, if they have some sort of a medical issue, the expression, "I'd like to get a second opinion," comes in quite a lot. I don't think that happens maybe as much with dentistry. And is that something people should be thinking about, just occasionally saying, I want to get more than one opinion on a major job before I proceed?
Absolutely. I think that's very good advice for anyone considering a treatment that they are not really 100% sure about, or what are the true options that they have. You want to hear more than one way to solve the problem. And from someone asking the question, I think as a patient, is how often do you do this? What's your experience? What's your training in this area? Why would I do that over a different treatment? Really getting comfortable with the choice so that the patient really makes an informed decision that meets their own needs, and not something that's just the one-off recommendation without those questions being answered.
I would say that's a very, very common question that we see on virtually every new patient in the specialty part of the office. And sometimes the patient has already been presented a treatment, often, and they're wanting basically another opinion, like, what's the situation? And some other situations arise that the dentist has already made a diagnosis of the situation, and the patient has been referred for a specific situation. So we have multi-levels of sources when patients come to the office. Sometimes they're coming by Dr. Google. Sometimes they're coming from a person that we work with very closely in the community. And we've been running study groups for 32 years in Edmonton, known as the Alberta Implant Seminar, which are for dentists and their staff. And this group of people who attend the seminar are very, very familiar with the options of how we do things, and they are very excellent at sizing up problems. So we have a small group, but we've had this group in Edmonton and Calgary, and we've done this meetings now for 32 years.
And so the best thing to come out of this group, I mean, how's that benefit the average patient, for example?
Oh, it's a group effort. I mean, you get everyone's expertise, history, being input into the knowledge into how are we going to treat that individual patient. So our discussions are very enlightening. When we look at something, as a group, we come up with all kinds of new and different ways to help this patient or sequence their treatment, sometimes streamline their treatment, so that it's not just one opinion. It's very very rewarding. I think the learning for the doctors and the team is amazing, because it's something they can take back to their office, and now they've learned something new they can offer their patients and talk about.
And I guess the benefit is each doctor can only pull from his own experience, unless you have a group like this where suddenly you're now learning from several doctors' experience, and that broadens your own horizons, and it does sound like a win-win for everybody. If you just joined us, we're talking to Dr. Elena Hernandez Kucey and Dr. Brian Kucey from Kucey Dental Group, South Edmonton Prosthodontics. You can get a hold of them by check out kuceydental.ca. That's Kucey, kuceydental.ca, or southedmontonprosthodontics.com. We have a really interesting segment coming up. We're going to talk about what's new in the world of dentistry. A lot to learn. Stick with us. I think you'll be happy you did. This is Talk to the Experts on 630 CHED.
The proceeding was a paid commercial program. The opinions expressed are those of the advertiser and do not necessarily reflect the views and opinions of 630 CHED. You're listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed are those of the advertiser and do not necessarily represent the views and policies of 630 CHED. Now, back to Talk to the Experts on 630 CHED.
Welcome back to Talk to the Experts. If you've just joined us, we are joined today in the studio by Dr. Elena Hernandez Kucey and Dr. Brian Kucey from Kucey Dental Group and South Edmonton Prosthodontics. You can find them at 4628 Calgary Trail up on the second floor. You can also find them online and learn a lot more about what they do at kuceydental.ca, and Kucey is spelled Kucey, kuceydental.ca, and southedmontonprosthodontics.com. And during the break, Elena, Dr. Elena and Dr. Brian, you said something when we were chatting that I have to say, it kind of made my, I don't know, I got tingle up my spine in kind of a bad way when you said there are a lot of people out there who have just given up on their teeth. Explain what that's all about.
Absolutely. We sometimes meet patients that, through no fault of theirs, maybe inherited some bad genetic problems, haven't been able to maintain or prevent the problems, and here they are with teeth that are hurting, loose, decayed, and very complicated to try and repair. And realistically, some of these patients just arrive and look you in the eye and they say, I don't want to fix these teeth. I'm finished. And of course, as dentists, we're going to evaluate it and still talk about what could be done if any of the teeth were able to be saved. But sometimes emotionally, and I think you have to respect the person has already considered this, and maybe it's fear as well, anxiety about dental treatment, and that's kept them away, and they just want something that helps them to move forward on having function and having health and having an aesthetic smile, something that looks good and supports their face, and they don't want to hear about all the other options. So Brian does a lot of these treatments. I do some of the steps sometimes to get them ready, but I call it almost bionic dentistry. We're taking the patient from a real problem and moving them forward to another solution that might help them.
Would you have some examples, sort of stories that could help our listeners understand exactly what sort of situations you're dealing with?
Well, we've seen, thousands and thousands of patients over all these years, and sometimes the patients themselves were active patients in dentistry with their dental health. Their parents used to take them for dentistry. They had fillings done in their mouth, and then sometimes some life event happened that they kind of moved away from taking care of themselves as good as they could. Some other problems could have happened, and then they've lost a tooth here, and then something else happens, and it's kind of snowballs after a while, and the person becomes very frustrated. They lose confidence in their smile, in their ability to talk with other people. They know they're not healthy, and it's a tough situation. So what is amazing these days is that our alternatives that we used to be able to give a person, which was basically remove all of these affected teeth and make them dentures, that treatment is now one of the least common treatments that we would do. So back in the 1920s, 30s, 40s, 50s, that was the treatment that would happen. But in the 1960s, in the mid-1960s, and then in Canada more in the 1980s, the treatments changed that we can take a person like that and in very few clinical steps restore them back to normal or near normal, which is absolutely life-changing.
Well, I have to imagine that would be one of your most gratifying days when somebody looks in the mirror and smiles and gets emotional about it.
Absolutely. It's something that emotionally brings the person back to where they wanted to be, where they envisioned, where they dreamt they should be at. And truly, sometimes the alternative treatments to try and fix the teeth and get them the same result is not even going to get to that place. So sometimes the reality is that we would do treatments that will achieve those goals that they have in less steps, and then the maintenance becomes manageable. They're excited about their teeth, and they learn to brush all over again because maybe that was something they gave up on previously, and we get them using a water pick. It gets fun. Like, patients celebrate, I think, the fact that they now have the health and the aesthetics and the function that they really needed and wanted, and they feel good. Their breath feels good. They're not embarrassed, and I think that that's so important that we can be a part of that.
Yeah, and again, we talked about the importance of getting a second opinion. I remember being a little kid, and my grandfather had all his teeth pulled out and dentures put in, and I remember being 12 years old going, was that the only option? Like, even at that time, thinking about that. And so I'm glad to know that there are many more options, and people, again, no one's more concerned about your own well-being than you, and you have to know to ask good questions, and questions like, what are my options? And
well, dentures are not teeth. They're a plastic substitute of teeth. So if anyone is a denture wearer, they know the realities and the limitations they have. And we hear all the time, well, I can eat anything, and you hear that outside. In our chair and in our private world, we hear the problems these people have with stability, with function, with being able to choose and eat all of the foods that they want to. So they accommodate quite a bit. I always say, if you watch people carefully in a buffet line, you can almost pick out the denture wearer. They're going for the pasta and the soups, right? And that's not in every situation, but we know that the minimum that patients should have when they do lose all of their teeth should be at least 2 implants to help hold the denture in place and reduce bone loss. And I wish people would hear that before they take their teeth out, because they don't know this, and then the bone resorbs, and then they arrive in Brian's chair, and they're in a pickle because they've lost so much bone. It makes their treatment so much more difficult and challenging.
I promised our listeners we'd chat a little bit about what's new in dentistry, and you have something called an iTero element scanner. Is that?
We use digital impressions for a lot of procedures, so it could be used to do something to make a tooth, a crown, a restoration, by not taking the goop, as we would call it, the traditional impressions, and we can sometimes do that treatment digitally and reduce make the patient's experience better, as well give us so many more options. When we've done a digital impression, now we can analyze this on a computer. We can collaborate with our laboratory. We can learn so much about the treatment and have that record. We can replicate things many times. Somebody says, oh, gee, I need this done a second time, or you want to change the shade. You've got that ability. We're even now going into more things into digital dentures. We're expanding into that area. Again, helping some of the implant procedures, taking those impressions for implants with a digital technique. Something that we have learned to help our patients and ourselves to give the treatment in a more profound way.
This whole area is really called digital dentistry now. So the iTero scanner is just one brand name of an intraoral scanner. So it's not an X-ray. There's no radiation involved in this, and it can be done very quickly and rather effectively. And there are many patients that when they've had that done, they are very appreciative of not having the traditional impression method, and some people who almost can't stand the other way will be managed quite easily in this method. But this intraoral scanner gives us a digital three-dimensional footprint or copy of the patient, which we can do all kinds of planning and designing and even manufacturing of the restorations. And we can also simulate for them what their teeth would look like when they go ahead and choose, for example, some type of clear aligner therapy, which has really replaced traditional braces about 70-80%, even in our orthodontic specialty practices. And it's as long as we can wear those retainers the amount that's required, which requires patient cooperation, this is much more rapidly and easily done than putting the old braces on teeth. So that's been a huge revelation. Making restorations with a digital impression is really very interesting. There's also methods that this impression information is sent directly to the laboratory the same day, the same appointment that you're there, so your restoration is already under construction. So it's shortened the construction time. It's also made a digital record of the restoration, so if the restoration is damaged in any way, we don't have to start over from scratch, everything used to be handmade.
Well, I had a friend who had the trays with the goop and lasted about 15 seconds, and she said she ripped them out of her mouth. She ran out of the office, and she never considered that surgery or that procedure again, whatever it was. I'm not sure what she was in there for, but do you find that just like that sort of anxiety on that process actually holds people back from moving forward?
Well, dental anxiety can be for a variety of things. Definitely impressions is a part of it, because there are people who have a very exaggerated gag reflex, and you kind of try and put even a small instrument in their mouth, and they have trouble with this. So we do talk about patients as part of when we get to know them. How do you feel about being a dental patient? How relaxed are you, or is this something that's very, very difficult? And again, for those patients who are sort of at that point where they've given up on regular care, we bring that topic up and find out that a large portion of them have been away from the dentist because of this, their fear, their anxiety. So we have to talk about techniques to help make them comfortable in the dentist's chair, to sedate them sometimes. That helps, whether it's oral sedation or more advanced treatments that they may need in order for them to be comfortable and for the practitioner to be able to do their best work rather than working on a person that's nearly running out of the chair, as you mentioned earlier. I think it's just a good idea to plan for success and make them tolerate the procedure and us do our best work for them.
I was looking at your website, and I saw you have there's some new advancements in dental lasers, and I'm wondering, is this a guy in a Star Trek suit that rushes in with a very small gun, or is it surpassed even that?
Well, we sci-fi, right? So yes, lasers can be used for a variety of things. A lot of times for soft tissue changes and disinfecting things, wounds in the mouth. Sometimes we have areas where we have to remove extra tissue that's in the way of perhaps finishing a filling or a crown. So we've got them right there at our fingertips, so that if it's needed, we can help that patient within that same appointment to finish what was needed rather than coming back. I think that's a good adjunctive therapy that we can help with. And gum treatments for people that have a lot of periodontal disease. Some of the lasers can be used to help with that, to help change the bacteria and make sure that we're not just scraping the bacteria off, that we're actually treating them in other ways, and using medications that will help give them the best outcome.
One of our listeners texted in, Gary, he's a hockey coach. He says he's heard conflicting things about what to do if a kid has a tooth knocked out. What do you recommend?
Well, hopefully not too many of these accidents will happen this season, but inevitably it absolutely does, even with the cages and actually properly adjusting those cages for the young players is very important, that they do not have contact of the cup on their chin. I'm a past hockey coach myself, and I'd be checking those little J hooks on the sides of their helmet so that there's not any load. But let's say something happens and the tooth does get avulsed, knocked out in the hockey rink. First thing we do is stop play, look for the tooth. And the tooth's sometimes hard to find because it can be white and you're skating on ice. So often what will happen, some people will go ahead and they'll get some shovels out and they'll know where this happened. They'll scoop up the snow, find the tooth, and the next thing we would do is shake the snow off and carefully put that tooth right back into place immediately. So should we put it under our tongue? No. Should we put it in a glass of milk? No. Should we put it in a glass of Gatorade and run to the dentist? No. The best thing is actually to take that tooth. If there's a lot of dirty stuff on it, you do have to kind of get that off, but to replace that tooth and then call your dentist. So the dentist usually will come on short notice to do this and help you. There are some emergency facilities in the city. There's the University of Alberta Hospital, which has got a dental clinic as well. But for our own patients, we prefer they just phone us, and we will see them anytime, day or night, as required. And if we can't do it for some reason, we will find another person to help them. But this is something that happens. It happens at not just at hockey rinks, but it happens at gymnastic events, happens at volleyball, basketball, all kinds of things where we should be doing. So another preventive aspect is, where is that mouth guard? So I wrote an article, a review article this last 6 months on mouth guard research, and unfortunately some of our heroes that we are going to watch at 2 o'clock this afternoon in the Oiler team are notoriously bad in complying with those mouth guards. In fact, our top 2 players are often twirling them in their lips while they're running around, not just at a face-off, but skating down the wing.
I was wondering about that.
Yeah, the
so
mouth guard
there
needs to be on in the proper position, and that's how you're going to get the best protection. So little kids, hopefully young hockey players and other athletes, make sure that you're wearing your mouth guard during the contact sport.
Where are their mums? Come on, put that back in your mouth.
Well, it's required actually. I know in indoor soccer, our children played indoor and outdoor soccer, and it's required that they have team mouth guards made. And I'm not talking about the boil and bite variety, that you pick up at the store. It's not that costly to make a custom fitted mouth guard, which allows them to breathe properly. And also, it reduces the shock if their jaws do get hit. In soccer, you're not going to wear a cage because you could get a concussion. And that mouth guard will help in concussion prevention.
We really need to take a quick break, but we will be back. We're talking to Dr. Elena and Dr. Brian from Kucey Dental Group. You can find them at kuceydental.ca. That's Kucey, kuceydental.ca, and South Edmonton Prosthodontics.com. Much more to come. Stick with us. This is Talk to the Experts on 630 CHED.
The proceeding was a paid commercial program. The opinions expressed are those of the advertiser and do not necessarily reflect the views and opinions of 630 CHED. You're listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed are those of the advertiser and do not necessarily represent the views and policies of 630 CHED. Now, back to Talk to the Experts on 630 CHED.
Welcome back. I wish we had more time than just an hour. I'm really enjoying this chat. We're talking to Dr. Elena and Dr. Brian Kucey from Kucey Dental Group, South Edmonton Prosthodontics. And in our first segment, we talked about the fact that both of your parents were doctors. Dentists. Your daughter's a dentist. You two are lifelong dentists. You work together in your organization. What would you like people to know when they come into your shop?
I would like them to know that it's so important to really have a vision of what you want for your health and to share it with your dentist as they review your choices, so that we can really provide the best long plan for you, the one that gets you to that golden place of health and stability and function. And that's what I would say. How about you, Brian?
Well, I think that every single person that enters our office can be assured that we are very concerned about them having a proper experience, and that the dentists themselves are not necessarily excellent patients, as you can ask my wife about me. So I have dental concerns as well, and I know that clearly. So I'm doing everything I can possible to make it easier and the easiest for that patient's experience.
Now, there's a lot of topics we wanted to touch on, haven't touched on them yet. We did talk about people who feel like they've just given up on their teeth and they've come in and found a second life through some of your options you've been able to provide to them. I had not heard about people leaving town, going on holidays and having all this work done, having a whole new set of teeth put in, and then coming back and finding out they were starting to have issues, and they come to see you. Brian, talk a little bit about that.
Well, we call this dental tourism, and although we're in Edmonton and we're very far away from the most common area, which would be Mexico, and even overseas, it's amazing that the number of people that are traveling to do this, because they're usually looking for a better deal than the cost of the treatment. They put up with a lot of uncertainty. They put a lot of hope. They often don't speak the language of the doctor that they are even having treatment with. And they're envisioning the dental treatment as a commodity. Whether I buy the bag of oranges over here or I go down to Mexico, it's the same oranges. These are not the same oranges. So we have requirements by law in Alberta that people enjoy the highest level of safety in patient management in the world. And we've done that for the last 25 years, our college is very strict in these rules, and the dentists on average are doing a very, very high level of service. But that's not transferable outside the province. So I won't say anything about BC and Saskatchewan, our neighbors, but certainly when we bypass the excited states of America and head down further south, we're going into unknown charted territory.
Yeah, and if someone is having issues, they can come see you. A lot of people from around Alberta travel quite a ways to see you because you're a specialist, prosthodontist. Can you talk about that in about 30 seconds?
Sure. I have patients from Ontario to Victoria, from Nunavut down to California. Not a huge number of them, but that's my little territory geographically. These patients are coming generally because they have complex problems and need special treatment. So this is what we offer to them. It's a great honor to be able to do this type of thing. And the other thing is we have to be very efficient in our management because the transportation costs of people coming that distance is very expensive.
And we talked about the fact that there are dental specialists. People can find a list of those in the
Alberta Dental Association.
Alberta Dental Association.
College of Dental Surgeons of Alberta.
Dental Surgeons, that's it. Find a list there if they'd like to know which specialties are available, because people don't always know. So again, the more you know, the better decisions you can make. And if you're looking for a dentist, if you like to find a family dentist, this is a family group. Their parents were dentists, their dentist, and their daughter's a dentist. So they'll be there for a long time. And it is the Kucey Dental Group, Kucey, Kucey Dental Group, and South Edmonton Prosthodontics. Check out kuceydental.ca. You'll find them at 4628 Calgary Trail Northwest, up on the second floor. Thank you so much for being with us today, and everyone else, have yourself a great weekend. This has been Talk to the Experts on 630 CHED.
The proceeding was a paid commercial program. The opinions expressed are those of the advertiser and do not necessarily reflect the